we're going to be talking about Q angles now, which is actually a really important measurement for most people that are going to be coming in and complaining about knee injuries. And with this, it's really helping you figure out where the alignment is and if it's correct or if it's proper. And this can give you an idea as to why they're maybe complaining of pain in certain areas. So the very first thing that you're going to do when you're looking for the Q angle to measure it is you're going to look at the patella, superior to inferior, and find the middle, and then also medial to lateral and find the center of it. And a lot of times people just put like a dot there so that way it's consistent. And then you're going to take your goniometer and you're going to take the fulcrum or the axis of it and put it right exactly on that point. And then what you're going to do is, oh, and I put it on upside down, is that you're going to take the stationary side and run it all the way up to his ASIS. So you're going to line it up right here, and then you're going to find their tibial tuberosity and then run the movement arm through the tibial tuberosity. So if they were straight, these should be lined up and be at 180. And with him, as we line these up, so we're going right through the tibial tuberosity, and we're going straight up to the ASIS, and then you're going to look at the measurement, and on his, not that you can see it, it's far away, but he has a 10-degree angle. And the angles that you're looking for are really 10 to 15 degrees. I've seen people with angles as low as 5, but you really need them to be in that area. If it's 0, that's totally abnormal. That means that they have no bend in their knee whatsoever, and they should have some valgus bend be involved in that, just because when you think about it, your condyles aren't even, and because your medial condyle hangs more distally than your lateral condyle, that's naturally going to put you into a slight valgus position. And so what you really want is for these to be this way. If people have genu valgum, meaning that they're really knock-kneed, you're going to see a much greater angle. If people are genu varum, meaning that they have bow legs, you're going to see them getting closer and closer to that 0 degrees. Ideally, they're not going completely straight or in the negative direction, because then we're going to be looking at lots of other pathologies, potentially in the hip, in the knee, or in the ankle and foot. But this is really good information to use along with leg length discrepancies and the rest of your evaluation to figure out what's going on, and is it more a bony kind of and pathological and biomechanical issue that's going on in their knee that's causing these issues, or is it leaning towards more of their soft tissues or some kind of injury that's been causing their issues.